Hello nurses and future nurses, welcome back to my YouTube channel. And on today's episode of Nurse Clement, I am going to show you on how to make physical assessments on patients. So this is going to be part one of the physical assessment. As time goes on, I will do other parts so that you can learn on how to do physical assessment nursing procedure. So do not forget to like, share and subscribe to my YouTube channel at Nurse Clement B. So do not forget to share, like and comment. In case you have any procedure challenges with any procedure and you want me to do, please just drop it at the comment section and I'll attend to it. So sit back and watch this video till the end. Do not forget to like, and I thank you all for your support. Thank you for your support so far. So on today's video, we are going to look at the first part of head to toe assessment, and I'm going to concentrate on the head alone. I'm going to concentrate on the head, right? Most especially the scalp. Remember, before you do any procedure on any patient, you have to introduce yourself, take permission, that is informed consent from the patient before you do that. And before you do this kind of procedure, you need to get an otoscope to view the ear, and also you need tongue depressor, and you also need pen light to view for the eye when you come to assess the eye, right? And also you need a glove so that you can do. These are some of the requirements that you need to do physical assessment. So sit back and let's continue with this procedure. Hello, good morning. My name is Nurse Clement and I'm here to do physical assessments on your head. Please, can you permit me? And I'm going to use my hands to do that since it's just only on your head. Is that okay? So, thank you. So, after taking an informed consent, make sure that you also know that this is the right patient. To achieve that, you have to ask the patient her full name or his or her full name and date of birth. And in case the hospital is using the handband with the full name, date and date birth of the patient, you can also confirm there, right? So I can ask my patient now to tell me his or her full name. Please, can you tell me your full name and date of birth?
John.
Okay. And your date of birth?
2011.
Which month?
February.
Okay, so now that we have confirmed that this is the right patient, then I will go ahead and do the physical assessment on this patient's head. So before I do that, I have to go and perform hand hygiene and then don my glove. After performing hand hygiene, then I don my glove. Always remember to protect yourself when performing any procedure on your patient. Very important. Remember, physical assessment is not a sterile procedure, it's a clean procedure. So the first thing to do is to look at the head of the patient. Is the head of the patient symmetrical? Is the patient head aligned with the body of the patient? Or the head of the patient is bigger than the body? And you have to observe also the skin color of the head of the patient. Now that this is Nigeria, this is Africa, some of us are brown in color, right? So I noticed that the patient's skin color on the head is okay. It's normal for an African person, right? So the next thing is for you now to look at her hair color is black, and also check out the distribution of the hair. Is the hair full, or are there any alopecia? That is scanty hair, and her hair falling off, right? Is there does she have bald head? So I can see that the hair distribution is okay, it's full, and the hair color is black, and the alignment of her head is okay, it's normal, right? So the next thing now is for you to check, to palpate the hair. To look at, to observe, to assess the scalp of the patient. Now, this is my female patient, right? I can see the scalp of the patient, right? I can see the scalp of the patient, that there is no infestation of lice. Remember, when you're inspecting the hair, you have to check if there are infestation of things like lice or scabies, or lesions on the scalp. Thankfully, this patient plaited her hair, so I can have access to the scalp of my patient. So you can easily, if your patient is a male patient, you can easily use your fingers and open the hair and check whether there are scars, there are lesions, there are infestations of things like lice in the hair of the patient, right? So the next thing now is for you to palpate the scalp of the patient to see if there are lumps, to see if there are to see if there is lump or any injury to the head of the patient. Or so you palpate the scalp of the patient, gently palpate the scalp of the patient to see if there are lumps or any scars on the head of the patient. So this patient doesn't have lumps or scars on the head of the patient. The next thing is for me now to palpate also the arteries, the temporal arteries. So now I can remove my gloves to go and to feel the arteries of my patient. You can use your two fingers, the index finger and middle finger, and palpate the temporal arteries of the patient. They are okay, right? So the arteries of the patient are okay. Also on the face of the patient, you have to check the muscles of the patient's face to see if there are some droopings, right? The muscles of the patient, for this patient, her face, there is no drooping on the face, right? Her muscles is normal and intact. And drooping, this occurs when patient is suffering from palsy or stroke. So you can see one side of the face of the patient will be drooping, right? So for these patients, she's normal and she's okay. So we can make assessment of the head of the patient. Remember, this video is focusing only on the head of the patient. Be able to dictate any abnormalities of the head of the patient. So we have come to the end of this video of assessing the head of the patient. So thank you for watching, and thank you for staying with me till the end of this video, and thank you for all your support. Do not forget to reach out if you have any difficulty in any procedure that you want. So just reach out. Thank you for watching.